Hello, my name is Christiane Lee. I work as a community midwife at Hillingdon Hospital, and today I would like to show you how to change your baby's nappy. You find out your baby has a dirty nappy when the baby is a little bit cranky or crying, or you do the sniff test. Then you have a mat that you cover with muslin or a towel, because baby do not like to lie on cold surfaces. If you have a ring on the door and you need to answer the door, you take your baby with you, with a nappy on, with a nappy off, no matter what, wrap it in the towel, take the baby with you, and then come up afterwards to change the nappy. So your baby is secure on the mat and nice and warm, and the towel is lying underneath, or muslin. Then I need some lukewarm water, and you just feel it with your hands. If it's too cold, your baby will tell you. If it's too hot, it can hurt the baby's skin quite badly. Baby's skin is much more sensitive than ours and burns more quickly. So the water is just the right temperature, and then of course you need something to wipe the baby's bottom. So you can use little cotton wool pads. You could also use reusable little flannels. These ones are made specifically for wiping babies' bums. They're made out of bamboo and they are reusable. Now I need to undress the baby. In order to calm the baby down, you talk to baby. The nappy that is used on the baby here is a disposable one. So it has little sticky pads at the front. If the nappy is not dirty, you could reuse it, so I'm closing the tabs to keep them safe. And then you have a look. Oh my God, baby has a dirty nappy. So we need to make sure that baby's bum is nice and clean. Usually the babies kick their legs, so you want to hold them tight in order not to spread the poo. And with the dry part of the nappy, you wipe away the worst of the poo that is on the skin. Yeah? Here we have yellow poo, and that is what your baby's poo looks like when the baby is 3, 4, 5 days old. It changes into a yellow color. It looks like mustard. In this case it is mustard. It can be also a bit grainy looking. And then I'm wiping all in the nooks and crannies, really important in those little skin folds, to get all the feces out, because if anything stays in there, it will aggravate the skin, it will make it get sore, and an infection can occur. So for girls, you're wiping downwards. For boys, you do not have to pull back the foreskin. You can just wipe on the surface. I show you now a reusable nappy. Okay, so you don't have to use disposable nappies if you don't want to. You can buy reusable nappies. This little nappy is actually made out of recycled bottles, and you put an insert in that is washable, and you stick it into the nappy, and then to keep feces away to sink into deeply into this insert, you can have a little strip from a roll, which is a disposable nappy liner. It's biodegradable, and that keeps the feces from sinking into deep, and this with the feces can actually be thrown away. And then you put that around the baby. So the part with the little tabs is at the back of the baby. The front is pulled through. And in this case we have Velcro, and can close it over the baby's tummy. So you don't want to close it too tight. 2 fingers need to fit in nicely. You don't want to make it too loose, because then the feces and the urine can just leak out, and that defeats the object. Some babies initially will still have the cord on with the cord clamp, so I would always fold this down a little bit to let the cord and the cord clamp not be pressed with the nappy into the soft baby skin. And here you are, your baby is nice and clean.